So when I started to pull the literature on salt, if you go on PubMed and you do literature searches, you'll get recent things in PubMed and literature searches. And I pull these articles, and I'm pretty good at it. I know what I'm looking for, and I know how to navigate medical research. I know how to read these articles. I know how to navigate them and know how to get them. And I start pulling these articles, and when I find a really interesting article, I look at the references, and I look at what the author is referencing when they make an important statement, and I pull their reference, and I go pull that article, and I start going backwards in time. So all through these salt articles, that salt equals hypertension, because of my experience, when I started to put my patients on salt as part of sort of a daily regimen, and I was having them measure it out and use an X amount of salt, and I didn't see the blood pressure go up. Now, once in a very blue moon, salt will raise blood pressure in somebody. And they're salt-sensitive people. They are not common. And there are patients out there, they are truly not common. And again, it's a little different with congestive heart failure and kidney failure. So I see a salt-sensitive patient, maybe, I would say less than one time a year. Way less than one time a year. Every couple of years, something like that will happen. So I wasn't seeing blood pressure go up. So I started to assume another myth in medicine. I was already practicing holistic medicine for a few years, and people were feeling better with it. It certainly wasn't harming anybody. And the salt levels were improving on their blood work. And, I was sure I was doing a good thing for my patients. So I started pulling these articles, and I started going back in time. There's all these references to salt and hypertension. So you go back, you find this article, you find this article, you find this article. Well, in the 1970s, I finally go back and they start all referencing this InterSalt study that says the use of salt is associated with high blood pressure. So I pulled the InterSalt study. It was somewhere in the early 1970s. It was a U.S. government-funded study, and they used, I believe, 8 or so medical centers across the world, 8 or so centers across the world. It was more than that. I think it was double-digit centers across the world where they looked at sodium intake and blood pressure in different populations. And then they put the data together, and they concluded that elevated salt in the diet is directly associated with hypertension. And, that was the conclusion of the article. And then conventional medicine ran with it and said, we all need to lower our salt. The United States gets too much salt. The average salt ingestion in the United States is too high. That's what's driving our hypertension epidemic, and we need to lower salt intake. The Surgeon General went on radio shows and TV shows, and he was in all the literature. And that was his cause célèbre at the time, to get the U.S. to lower salt intake. And so I pulled a study, and it literally, I don't know, took me 20 minutes or so to see that it's like the Wizard of Oz. You pull when Toto pulls the curtain aside, and you hear the fire and the wizard saying, who, don't talk back to me, or whatever he said to him. And then they realize it's just a guy back there, with the levers, and he tells them to ignore that man behind the curtain. Well, that's what I feel like I'm doing every day, is pulling the curtain aside. So I read that InterSalt article, and most Western centers where they studied sodium intake, and they studied sodium intake by measuring urinary sodium output, which gives you an idea how much sodium comes in. And then they did blood pressures. And in a bunch of different centers, there's no correlation. Some had high salt intake, some had low intake, and the blood pressure, there was no correlation. In 2 of the centers, there was a correlation with low salt intake and low blood pressure. And that's where the conclusion of the article came in, that high salt causes hypertension and low salt's better, and we need to lower our diet. Well, the 2 centers were non-acculturated populations. They were tribes. One was in Brazil, and the other was I studied them in college at the University of Michigan, the national champions in football. And it was what was the name of that group? The Yanomamo Indians. My professor at the University of Michigan did his PhD thesis on the the Yanomamo Indians. So guess what we learned a lot in cultural anthropology? I knew the Yanomamo Indians backwards and forwards after that semester. So the Yanomamo Indians didn't get a lot of salt in their diet, and they had very low blood pressure. And so because of that, we were told to lower our sodium intake, our salt intake. Well, the Yanomamo Indians, and I remember this from my class, the Yanomamo Indians died around age 50. They didn't live to old age. So we know blood pressure goes up as people get older. And maybe their blood pressure didn't go up because they didn't age and they died at a young age. The Yanomamo Indians hunted for their food. They didn't go to the grocery store. They didn't eat refined foods. They ate whatever they could gather, whatever they could kill. And so they were all thin. They didn't smoke cigarettes. At least I didn't remember learning about that. And I don't think the two non-acculturated populations were really something that we should base national policy on for the next, now we're into 50 years or so from that study came out. And, that was where it really took off, that we need to lower our salt intake. And then, there's a couple of other studies where they give rats just enormous amounts of salt that we would never eat. We couldn't eat in a day. We just couldn't do it. And it screwed up a bunch of functions in their body, but their blood pressure went up in the poor rats. But I can tell you with a lot of experience in treating thousands of patients with salt and unrefined salt that their blood pressure doesn't go up in the vast majority of patients, and they feel better.
It's almost like people talking about estrogen being bad. Well, there's good estrogen, there's bad estrogen. It actually should have a different name. Refined salt and unrefined salt are two very different things. And when these studies come out pointing to salt as the bad guy causing stomach cancer or heart disease, they're not looking at the full diet. They're not looking at the fact that 70% of the American diet today is processed food with stripped down sodium, with none of the trace minerals, full of microplastics. Then you add in the glyphosate and the GMOs and the gluten and the toxins that are in that food that's driving up insulin resistance and blood sugar, high fructose corn syrup, all of these other things. But what you have to do, and you kind of touched on this, is who's benefiting from a low salt diet? Like, let's follow the money. And be careful with how I say this. You are getting an increase in statin drugs and diabetic drugs when the government started pushing low salt diets.
So that's, you know what, that's a really good lead in. I'm looking at my chapters in my book. A low salt diet, it's chapter 4 and 5. I talk about this. I was trained that any amount of salt causes high blood pressure. Therefore, the lowest amount of salt is the best. And period. There was really no discussion on it. But what I've learned is a low salt diet promotes hypertension. So if you put someone on a low salt diet, salt is such an important substance for the body that, the reference range in our lab tests looks like this, but really our body really wants to be in a reference range of about like this, a normal range of like this. And it doesn't like to be up here and it doesn't like to be down here. So when you drop your sodium levels down, which you can do on a really low salt diet, I mean, you can do that, especially if you're elderly, you can do that really fast. But if a bunch of triggering mechanisms come into the adrenal glands and the kidneys to help the body resorb sodium and not pee it out. And that includes hormones like renin and aldosterone. And these things, renin and aldosterone, raise blood pressure. So a bunch of antihypertensive drugs have anti-renin effects and anti-aldosterone effects. That's how they work. So it's interesting that we're told, well, low salt will lower your blood pressure, but no, low salt causes hypertension. Then you're going to need medication to treat the elevated hormones that are trying to restore you to homeostasis and raise your salt levels. And if you feel like I'm talking like I'm in Alice in Wonderland, where down is up and up is down, that's exactly where I'm at. And
I
unfortunately,
love
that's the
that
world
you're
we live in
saying
today.
and I love that you're talking about the stress hormones, because will you dive a little deeper into the fact that when you are working your adrenals, when you're really stressed out, you actually need more salt. Your body uses that salt when
Yeah.
you're doing something very mentally tasking, like studying for finals or getting ready for a big project, or you have got family stress. Your body needs more salt to help support those adrenals.
You know, I got this picture in the book that shows the relationship. It's in a chapter on salt and the adrenal glands, and I go through the literature showing that we got enough hypertensive meds to lower renin and lower aldosterone levels, and triggers a whole cascade of effects to constrict the blood vessels and to try and get the body to resorb sodium, when really the treatment for it is more salt. I've gotten so many hypertensive patients off their hypertensive drugs by putting them on salt and monitoring their levels, and then getting them off these anti-renin, anti-aldosterone hormones. I mean, anti-aldosterone drugs that are out there.